So Bonnie is going to be our person today, and so one of the first things you do is you fill out a little profile for us about your medical history. We ask you some questions just to make sure that there's nothing medically that would prevent you from receiving CoolSculpting. And Bonnie passed with all flying colors. She is, there's no medical reasons that she can't get the treatment. So then the next thing we kind of do is we bring everybody back to our CoolSculpting room, which is where we are right now. And I just get to know them and learn a little bit about, you know, their history. Have they been a guest with us at Sonara before? You know, what kinds of results are they looking for? What are some of your goals? We just kind of get to know each other like girlfriends and you know, if a guy's here, then they become one of my guy friends. But I try to make you not as uncomfortable about the process and answer any questions you might have. So Bonnie knows a little bit about CoolSculpting already, so she's probably not going to have a lot of questions about how it works or, you know, the process of cryoliposis. Her main concern is probably what areas she can get treated. So Bonnie, what are some of your main concerns?
Well, part of my main concerns is just I work out a lot, always have, but there's that last little bit that doesn't go away, and I think that's my thing is I just want to get rid of the tummy area, maybe around the sides, just something that I feel like I'm working out over and over and it's not going away. Okay. So I thought this might be a way to help that.
Perfect. And then some of the things I'll ask them if they've had any other procedures or things like that that they've done to try to, you know, combat fat. Some people have had liposuction or done CoolSculpting before, so that's always good to know.
I have not had any of that, so
okay, so
this would be my first time of any kind of.
And then we go over any concerns they might have. A lot of people ask if it's painful, and I just kind of go through that with them. We talk a little bit about the history of CoolSculpting, where it came from, how long it's been around. Right. So at this point, making sure that Bonnie is one, a candidate and has no medical issues. Two, we've talked a little bit about the areas of her concern, which were her abdominals and her flanks. What we ask patients to do at this point is to get into a robe, and then we kind of go through it together, ask them to come out, and we start to looking at the areas and kind of figuring out what applicators we might use. There are a lot of different applicators for CoolSculpting. So depending on the person, we're going to choose a different applicator and a different number of applicators. All right, so now I'm going to have Bonnie get dressed into her robe, and she brought a swimsuit today, so she can wear that on video. Doesn't have to show everybody all of her intimate apparel. So we're going to have her get changed, and then we'll do the consult from there.
Okay.
All right, so here is your robe.
Thank you, ma'am.
Yeah. So generally the guest will come out and they'll be in their gown, and I'll have them disrobe because, you know, we have to really start talking about the areas that we want to treat. So if you want to go ahead and disrobe, and you can lay it over here on the table. Great. All right. And so we talk a little bit to Bonnie today. You know, she mentioned her abdominal areas and her flanks. So what I do is I try to educate the guest a little bit about the abdominals. So in CoolSculpting, we kind of take the belly button, think of it as your midline, all right? So anything that's above your belly button is considered your upper abdominals, and anything that's below the belly button is your lower abs. It makes sense when you think about it that way, but a lot of people focus on the lower abdominals and they don't think much about their uppers. But I think of it as one abdominal altogether. So as women treat the lower abdominals, I also check the uppers to see if there's anything we can do there as well. So for Bonnie, I'm going to kind of talk to her about the different sizes of applicators. We have a larger applicator and a little bit smaller one that we use on the abdominal area. So what my job is to really pick the best one for each person. So I kind of come down here and I just ask you to stand up like you're standing, and we start doing some of this because I want to make sure that there's actually fat in there and that it's not just skin. A lot of people will come in and they'll just have loose skin, and that's not something I can fix with CoolSculpting. So Bonnie's skin starts about right here, but through here you can kind of see where her abdominal could be treated with the CoolSculpting applicator. So I come over here and I just kind of check it to kind of see this is where her skin starts. Oh, she's run a marathon, for all of you who didn't notice her little tattoo. Congratulations to you, that's a lot of work. And then I also look at her upper abdominal, so you can kind of see there where she would be able to be treated in her upper abdominals as well with CoolSculpting. So she's really a good candidate for all of these areas. So then I kind of take the applicator and I think, which one would be best for Bonnie? So what I would recommend for her is doing one here and one here. So we're gonna get everything down here, okay? And then in our uppers, we could do this one again, but I don't think we need that one. I would recommend the smaller one, just to do right here to get this area. See that? So I'm going to draw on here for you so you guys can kind of see what I would recommend for Bonnie. And this comes off. So you don't have to wander around the neighborhood with this. So I just remember I said her skin started out here. So this is kind of where I'm going to start her applicator. And I'm going to do this. And this is where the applicator will go for her, right through this lower section. And then on the other side, we're going to do this. And so through the middle, she's going to get a little bit of a double treatment, which is not a bad thing, right? We'll always take a little bit of a double treatment to our problem area. Draw it on there like that. Excellent, Bonnie. Such a good model that you are. Right through her marathon, running right through it.
3 of them, actually.
3 marathons? Well, shoot, girl. I wouldn't have knees left if I did that.
It's been a while.
So now I'm going to draw the upper abdominal so you can kind of see like where that would go. And you can kind of see it just even with following the shape of Bonnie. She's got a perfect place for an applicator right here. So we kind of just follow that shape right where she's got it. Measure it up. And this just gives us a guide, and it also just says to the patient, is this what you were thinking? Does this kind of give you an idea of what we would treat? And it helps them. And if they're like, you know, I was kind of thinking something different, then we can redraw. So that's her upper abdominal. All right?
Perfect.
Perfect, right?
Well, that's the area that I want gone.
Perfect, good. All right, so that's what I recommend for you. So let's take a look at your flanks, because I know you mentioned those, so you just want to turn to the side here. So the great thing about cool sculpting, it treats abdominals, also treats flanks basically from your belly button up to underneath your bra fat, okay? And I don't know, but after I turned 45, somehow I ended up with this weird bra fat thing. So that's my next thing to treat for myself. So this is your flanks. This is, not everyone's shape is different, so not everybody has this. A lot of men come in for flanks, because this seems to be where the men carry the majority of their area as well. So Bonnie is definitely, if you can see that right there, she is a perfect candidate for the flanks. And this is what I would do there as well. Okay. That makes sense. So that's her flanks. Let's see the other side. Most people have the same issue on both sides, but sometimes, you know, I've frozen just one inner thigh before for somebody because they didn't have a lot on the other inner thigh. So everybody's body is just a little bit different. And that's why you kind of have to have somebody who's been doing this a while and done a lot of treatments so they can kind of know. So see, her skin kind of starts right here, so I would definitely, she's a little bit farther to the back side on this side than the other one. So you just,
That is kind of odd that they're so different.
yep, it's just everybody's shape is just a little bit different. All right, so there's her flanks. Perfect. All right, so go ahead and face the camera for me, Bonnie. So that looks pretty good. Let's go ahead and put your arms straight out like this. Okay. So one of the other areas that's really popular for women is this underarm area right here. Bonnie's got great arms. She doesn't have a lot of arm tissue hanging down, but one of the things I look for is just this little section right here. And some people have more than others, and it's very hard to tone your triceps as you age. And we're fighting gravity a lot of the day with our arms as well. So we have what's called the Cool Sculpting Petite. This is used to treat the underarms. It's created specifically for this area. So that's an area we could treat on Bonnie as well. And then this is really great for these little pockets of, you know, fat that come right here around the bra, or even right in here for some women. It's not a lot, but it's enough that hangs over our bras. You can see it when our shirts are off. Or shirts are on. Shirts off and on. So that's an area where we would use the Cool Sculpt Petite. I also do this on people's inner thighs from time to time, and I also treated just this little inside of my knee with this one. So it's a really nice adapter because it can treat some of those smaller areas that bother us but don't need one of the bigger adapters. Okay? So for Bonnie, the last thing she talked about, even though she didn't want me to show them on camera, were her inner thighs. So we're going to talk about that a little bit. So Bonnie, go ahead and stand on the outside of the ones. So when I consult people for inner thighs, what I'm really looking for is almost like this hourglass. So go ahead and stand straight. See how she has this little hourglass shape right here. That's a great candidate for cool sculpting, okay? So we can do it two ways. We can either turn it this way and treat it like this, or we can treat it up and down this way. So it really depends on the person and where their tissue lies. So she's got a lot right here at the very top of her leg. So for Bonnie, I might turn it this way, see that, and treat it right here. So it's just a little bit different depending on the person. And I think that's why the consultation is so important. And having somebody who knows how to use the different adapters and the best way to treat you personally is what really matters. All right, let's stand up straight for me, Bonnie. And so her other leg, I would treat straight up and down like this. And I would treat it that way because her other leg doesn't have this section that's right here. Okay, Bonnie is not a candidate for the outer thigh treatment. That actually requires that you have a bump. It's a very distinguished bump. A lot of people, it's a hereditary thing. Their moms have it, so they have it. Their grandmas have it. You do not have that, nor do I. So I've never been able to do my outer thighs because I just don't have that bump that you need. Okay.